It is EMS week this week, and each and every day on Daytime we are showcasing a different aspect of emergency medical service. And today again we are with the Ottawa Paramedics, but we're speaking with Giselle Bouliane. Thanks so much for being here.
My pleasure, Millie.
Now you are an Advanced Care Paramedic.
That's correct.
Okay, so what does that mean?
Well, as my partner explained yesterday, to achieve primary care you have 2 years in community college, and then you write a provincial certification exam.
Right.
In order to achieve advanced care, you spend another year at college and then write another certification exam. And in Ottawa, we have these 2 levels. Hopefully, in the not too distant future, we'll be achieving critical care as well, which is yet another level up.
Wow.
We're
So
looking
on this
forward to
second
that.
level, what more expertise do you have?
We administer 20 different medications to patients in life-threatening situations. We can intubate, which means providing airway support for people that cannot provide it for themselves. And chest needle thoracotomy, all kinds of wonderful techniques that you see on ER every week.
Wow. So
And things that we can't really understand
No.
when you tell us that.
exactly. So let's take a look, because you brought along some of the medications I understand that you can administer.
That's right. As you can see over here, we have some narcotics. We have morphine and fentanyl, which are used for different types of pain, chest pain, as well as severe fractures, dislocations, that type of thing. We have dextrose, which is administered to diabetic patients who are hypoglycemic, and this is probably one of the best medications that we have in our bag. It definitely makes a difference in someone's life. All sorts of different things. We have epinephrine and atropine lidocaine, which are used in cardiac arrest situations. Dopamine, hopefully when we manage to get a pulse back on a patient.
Right.
And we can support their blood pressure with
So
this
do you
medication.
carry all of these medications with you at all times?
Yes, sir, we do.
Wow.
Wow. Now, is this relatively new for the Ottawa Paramedic Service to have the advanced care?
It's new since 1995.
Okay.
So-
yeah, it's still youngish, 10 years.
That's correct. We've made great strides. It's improving all of the time and continues to improve.
Great. Now you're going to show us how to improve someone's life, basically.
Improve someone's life by shoving something in their mouth.
Well,
What are we doing today?
Well, I briefly mentioned intubation, and when we intubate, it's a very difficult invasive skill. But we
Okay.
do have another type of airway that we can insert called a laryngeal mask, and I want to show you how to put that in, which will
All
also
right.
support an
Okay.
airway for you.
Now,
Okay?
when would you be doing something like this? You find the victim in what kind of state?
Usually a cardiac arrest.
Okay.
So a pulseless, vital signs absent situation.
All right.
Oh no. Okay.
Yeah.
See, the stress level went up when she
I know.
said that.
Now
That's
I'm worried
scary
about
stuff.
this young man.
I know,
Okay.
but it's no laughing matter, obviously. So what are you doing
So
there?
right now I'm lubricating this to make it more easy to, or easier to insert for you.
Okay.
Okay. So what we're going to do is you're going to stand at the head of the patient, or
All
Derek
right.
will, either
Oh,
one.
yeah, I can do
There,
this.
Derek.
Okay.
All right.
If you want to grasp the patient's jaw,
Okay.
this way.
Like this.
hold this in your right hand.
All right.
Okay. And we're going to insert it in his
Okay.
mouth and press
down.
down
And just keep
until you can
going.
go no further.
Okay.
That's correct.
All right.
That's just like they do
And
on
now,
ER.
absolutely.
Well, I watch my share of television, Melanie. I know what I'm doing here.
And
So
what
what
we'll
have
do,
we done here by inserting that?
we have placed this mask directly over the larynx, which
Okay.
allows us to use this bag valve mask now. We're going to attach it here.
And is this opened the airwave? Is that
This
the
is
idea?
holding the airway open and providing
Okay.
an access to the lungs. Why don't you give that a squeeze and we'll
Sure.
see if the lungs inflate. There you go, the lungs are inflating.
Look at that.
So you've successfully given this person a great airway.
Ladies and gentlemen, Dr. Phage is in the building.
So
very
how
much.
long does it usually take, not take, but how long do you need to perform this procedure before you're at risk of actually losing the patient? How quickly do you have to
Oh,
get
within
this
the
done?
first couple of minutes, we want to have a patent
Really?
airway for the patient as soon as possible. Now
Okay.
we're going to make an effort to do that using our intubation kit with a scope and all of those wonderful tools that you see on television and in the movies. And if we are not successful, then we will go to this type of airway, and that will support it for a cardiac arrest patient.
So we're lucky that we can see the lungs themselves here. But when
That's
you're
right.
when you're working on a patient, what do you look for? Just that the chest is going up and down. That
We
sort
will
of
look
thing?
for chest rise. We'll also use our stethoscopes, and we will auscultate the patient's chest to hear the air actually entering the lungs.
Okay. Is mouth-to-mouth resuscitation kind of a dead thing now? Does anyone perform that anymore?
It is still performed in a situation where you don't have the opportunity to use a bag valve mask, but now in the new CPR protocols that have been taught internationally, it is now optional.
It is, given Why is it optional now?
Given the number of diseases that can be spread and the germs that can be spread from patient to patient now.
So is somebody at your level, you're at an advanced level, do they go on every single call that you get as far, you know, when you go out in an ambulance?
Do Advanced Care Paramedics go out on every call? We're trying to achieve that in Ottawa. We're almost there. We try to have split crews so that we have a paramedic that is a primary care and an advanced care in each vehicle. And we're almost there. We've achieved, I think, about 75 or 80% now.
Great.
So it's going really, really well.
So is this a career too that you would tell people at home that we need more paramedics out there, and it's a good career to follow?
Absolutely. It's improved by great strides through the years. The salaries have increased as well, which is not a bad thing.
Not at all, and very well deserved, I might add.
Thank you so much for being here, Giselle. And again, that's Algonquin College program, correct?
That's correct, for advanced.
Super. Thank you so much. Okay, we'll be right back after the time crunch tip. We'll see you in a second. Thank you, Giselle. That was great.
She's breathing fine.
I know.